Yes, we're streaming live. So,
Oh,
hello. Thank you
right.
so much for joining us of a Thursday evening. This is our Glow Live episode 2 with the Sur Medispa series, and I'm absolutely buzzing about tonight because I feel as though we're going to be talking about an absolute wonder treatment, which is exclusive. Hold on 2 secs. Just there we go. Which is exclusively available in Scotland in Sur Medispa. So the Glow Live, just as a wee intro, is designed to bring you lovely lot with inspiration, information, and entertainment. And we're doing that with chatting to some amazing experts from the GGC community and beyond. So all very exciting. Now, everything obviously that we talk about in the Glow Live, we always recommend that you do your own research, find out what else is available, but it may well be that what we talk about in these episodes is right for you. So we're going to get right into the nitty gritty. So episode 1 was with the lovely Karen as well. So Karen is the clinic director, independent nurse prescriber, and advanced aesthetics nurse practitioner. Yes, I said it without looking at my paper. I was like, yeah, I'm going to get this tonight. So, a woman of many talents, Karen. And last time we were speaking about the Juliet, which was a gynecological laser treatment. And tonight we're talking about cool laser, which is facial. So, we've gone from fannies to face.
Yeah, one end of the body to the other.
Yes, and both very important, let's face
Yes,
it.
yes, exactly. That's it in a nutshell, Laura. 100%. That's hilarious, actually. Do you know, I never even thought to put it across like that tonight. That's actually good.
No, I love it, and it's so important, obviously, to cover all bases. So I feel like we're really going for this. So I've been putting shouts out in the community for members to send us questions on this particular treatment, which is also known as the Hollywood peel. So, obviously, if it's good enough for the likes of Kardashians, JLo, Iggy Azalea, Lady Gaga, it's good enough for all us. We might have paused a wee second. We'll just wait for Karen to come back. Oh, I think you're back.
Oh, yeah, you're back, you're back.
Oh, this bloody unstable internet connection. I'm sweating. Right, okay, let's get into the nitty gritty, Karen.
Right,
Let's get
let's
into the
do it.
questions from the community. So the first one was, is this treatment available now after lockdown? So when we're allowed to, when I know that you're reopening and government guidelines and whatnot, or is it soon to launch?
No, we've got the laser available in the clinic, but like you said, Laura, we are really working very close with the government guidelines and Healthcare Improvement Scotland's guidance as well. So we have to obviously make sure that we're doing it when they're indicating. At the moment, there doesn't seem to be any sort of restrictions around face coverings being removed, but obviously before we do anything, we'll be checking, make sure we're working firmly within those guidelines. But the laser is in clinic just now. As you know, the 7th of May is our first gynecology clinic with the laser. So we have it for treatments to start. Yeah.
Okay, exciting. Right, okay. So talk to us about the process of the treatment and what it does, because that will really kind of open it up for people as well.
Well, we know that laser is widely used it's been around for years, laser's been around, but there's different types of laser. And basically it's just comparing the two. The most common for ablation, which is taking that sort of top surface off and creating a bit of destruction there, is normally with your likes of CO2 lasers. This is slightly different where it's not taking it to that amount of heat, so there's not the same destruction. So it works slightly different in terms of that, but you get a far nicer response. Like the joules that cool laser goes up to is less than what a CO2 laser would go to. So there's less destruction to the actual skin, but you get a far nicer, sort of lesser recovery time as well, and a more overall sort of uniformed response. But we can get obviously the actual science of that across later if you want us to go into the nitty gritty of that. I'm quite happy to do that as well. I could even just kind of touch on that just now, actually.
That'd be brilliant.
Yeah, so the aim of the laser really, the aim of lasers really is to target like the chromophore. So that's quite like, if you're going in for like a vascular treatment, you're wanting a laser that's going to target like deoxygenated and oxygenated blood. So For the skin, you want a laser that's really good, for skin treatments, you want a laser that's going to be absorbed in water. So basically, the higher the absorption rate, the more effective it is at removing sort of water and dehydrating. So the cool laser works more, it still works with heat, but the reason why we call it the cool laser is because it works slightly differently in terms of heat. It's not going to create as much heat as what, or destruction as what the CO2 does. So cool laser has the highest affinity to water than any other laser that's on the market just now, which is what makes it so different to the others and which makes it a little bit more effective for certain treatments. So that's what separates it really from what else is out there. So CO2 creates a lot of irreversible thermal damage, whereas cool laser is very minimal with the thermal damage that it creates. So again, that's your less downtime, things like that. So that's really where you can see the differences and where we would class this more superior almost to that.
Okay, amazing.
That's really what attracted us to it as well. And the fact that obviously it is widely used and obviously the results that you're getting from it is amazing. This chat tonight was about the light laser peel, where it's just a really nice sort of lunchtime type resurfacing peel that's going to give you that nice all over texture, quality and complexion, nice glow. A really good one to prepare your skin for like maybe a red carpet event or a, you know, like, you know, some sort of like wedding or something the day or two before, because there's minimal downtime, a bit of mild erythema after it, but, you know, nothing too, you know, crazy like you would if you were going more ablative. But you can get, and this is obviously why we can make claims of taking literally, you know, removing signs of aging, where we're talking about lines and wrinkles and age spots. You wouldn't necessarily get that with the Hollywood peel, you absolutely wouldn't actually, but you most definitely can with full ablation on this laser. And because of the, you know, the limitations of thermal damage compared to the CO2 is why you get a much lesser, you know, recovery time. With CO2, if you did full ablation with that, you'd be looking at a recovery time of between 2 to 4 weeks. Where you're going to have quite a lot of, you know, damage almost to the skin, like in way of like it's really red, angry, sore, and you're literally going to be kind of housebound for at least 2 to 4 weeks. Whereas with cool laser, you're looking about 7 to 10 days, and then you can just use a bit of mineral makeup and you can get about, you know, your day-to-day chores without being too obvious that you've had something quite significant done to your skin. So again, it's to do with the thermal damage, but if you went full ablation, you can absolutely take away, you know, perioral lines at the side of the face, all these types of things, which it does absolutely remove signs of aging if you go for full ablation.
So what's full ablation, Karen? I'm rubbish. I was rubbish at science as well, but what is that like?
So it depends. It's the depth of which the laser's going to. So if you go for like a lighter peel, you're just upsetting the very superficial layer of the epidermis. You're upsetting that, and you're going sort of down into the dermis. But if you're going full ablation, you're going deeper down, and you're creating more damage, really, to create that more. What you're doing with a light laser peel is that you're just stimulating collagen to give you, with the heat really, to give you that nice sort of glow, and it does give you that nice sort of all over rejuvenated skin. When you're going full ablation, you're going deeper in a level and a more ablative. So it's taking away that sort of, that it's giving you that new skin. For me, I don't have any problematic areas of scarring or real deep lines. But I was actually just saying to the girls in clinic, you know, we're talking about it. I was saying, you know, I'm definitely wanting this because I just want a new skin. You know, I want, you know, all my wee blemishes and things away, and just to give myself that really, you know, rejuvenated glow. So you could do like a nice course over the of light laser peels, or if you wanted hard, fast results, you could go for the full ablation.
Okay, amazing. Right, okay. This is probably because I actually, we spoke before the live, I slipped in a wee question from me, from the community. This is probably a good time to ask that question because my mum had a laser peel, and it was years and years ago, and it was on, I'm sure it was on the NHS. My mum had really, really bad acne scarring, and it was like, you know, the singer Seal, and he has those lines. So my mum had those lines. So she got around a laser, and like you said, it was about I mean, my mum didn't come out of room. Like, she didn't come out of room. And I remember seeing her one time and thinking, oh, wow, like, I mean, she was like, and it was like a different face, like, because it was obviously all healing and everything. And then she got it again, a second time round. So would that be like full ablation then?
Oh yeah.
So that's like,
they've probably used a CO2 laser on her, you know, obviously
okay.
not knowing her history or anything, which obviously if we were to look at your mum, Laura, and have a look to see what we can do with what you're describing as what she's been left with.
It's like a build up. It's like when the two skins meet.
Yeah.
Yes.
Yeah. So that's what we're saying, you know, like, you can't reduce the thickness of the skin with a laser, but what you can do, if there's, you know, lines or marks there, you can almost feather it to blend and create that more uniform sort of effect on the skin. So we're not reducing the thickness or anything like that, but we are sort of creating that nice sort of smoothness and feathering across any, you know, noticeable lines that's been created from the laser treatment before. But with the likes of your mum and anyone else that's coming, there's a full consultation process, a full history is taken. There's considerations of medications that they're on, skin cares that they're on, you know, if they've got any medical conditions that may be contraindicated. All of that is, you know, established at consultation process, and then a bespoke treatment, because this cool lasers, there's not one setting that does everything. There is a multitude of settings that's going to target specific concerns and skin goals. So we can really adjust it and make it a bespoke treatment to the individual rather than a one size fits all approach, because it's absolutely not that. And we can go, like we say, we can go like really quite progressive with the results, where it's over a period of time, or if someone's just wanting to go hard and fast and just wanting that, you know, quicker turnaround, but prepared to put up with a wee bit of downtime, we can do that as well. That option's available. Acne scarring, Laura, with the cool laser, from clinicals that I've seen from the medical professionals that are using it down south and in the States, are amazing. The before and afters they're getting from fine lines, wrinkles, aging, age spots, acne scarring, phenomenal results. So it's definitely something that they can look at and treat.
It's amazing how technology is just coming on, isn't it? And it's
absolutely.
So much more widely available. Right, amazing. Okay, great. So how long, so we're talking about the Hollywood laser peel. How long would that treatment take?
So we call it like the Hollywood peel, but it is like a lunchtime peel. I mean, you're only doing maybe 1 or 2 passes of the peel itself. So by the time you like sort of prep the skin, come in, obviously take a wee consultation process. We would do that like online just now to meet with COVID restrictions. We're not having any consultations in clinic. So we're doing a lot of that prior to them actually coming into the clinic, which actually cuts out a lot of the appointment time as well. So it's quite nice to just get all of that out of the way. And then as soon as you come in, you're just getting straight into the treatment, and paperwork and things getting done online as well now. So we just sort of check everything over again very quickly, make sure everything is in order, and then just start the treatment straight away. So you could potentially do this treatment in about 15-20 minutes, because it's a very quick treatment. The sort of, it's the mask after it that we leave on for 10 minutes. It's probably the longest part of the whole process, just to sort of reduce the cooling time and make them a wee bit more comfortable before they go out of clinic. So yeah, it's a very quick treatment. Actually, it's an amazing treatment. I actually can't wait to start doing it in clinic and get it myself, actually.
I know.
I've not had it done since before COVID, and I get down to London and they were doing it in May, and they've even got like this heat sort of platform, and it's not laser, it's just pure heat. And again, if you were going to an event, I got it done when I was in London, and I went out in London that night and my skin was just glowing. I couldn't believe my makeup was just looking amazing. I thought, this just with the heat, not with laser, just the heat on my skin, just stimulating that collagen process. Skin just looked so good. I thought, I can't wait to get that up in Glasgow, and I'll be on it all the time. Well, I say that, but I probably won't, because I'm always last to do anything to myself.
Oh, brilliant. Well, I mean, like you said, there's probably lots of, like, now that weddings are coming back around again, there'll be lots of potentially brides to be, mums of the bride, who might be like, well, this sounds like something that would be aisle ready. like red carpet ready, but aisle
Are
ready.
you ready? Yeah, yeah, that's a
Amazing.
good one. Yeah.
Right. You can use it. There you go.
Steal
I'm
that
only
one, yeah,
joking.
definitely.
Right, brilliant. So does it, and I think I know the answer to this question, but somebody else has asked, does it hurt?
It's more heat than hurt, to be fair. A lot of people think lasers, don't get me wrong, if we're going down the road of like the more hardcore treatment, then yeah, you're going to feel quite warm and uncomfortable, but it's like no pain, no gain type of thing when you're going to that level. And I think when people are going to that level, they know what they're signing themselves up to. They know there's going to be a bit of downtime and probably a wee bit of uncomfortable sort of feeling around it. But this Hollywood peel, no, it's a bit of warmth, if nothing else. It is not sore at all, no.
Okay, right, okay, amazing. Okay, is there any reason, so someone's asked, is there any reason why I couldn't get this treatment?
So there are contraindications, you know, some like, again, pregnancy. I mean, it's the most unfortunate thing when you're pregnant, you just can't get anything, you just have to go with it, don't you? I mean, you get so many pregnant patients in the clinic that we do offer very few sort of more nice sort of facial type things that are not contraindicated. But, you know, when you're pregnant, you just have to go with it, don't you? And just can't wait for baby to come and go and pamper yourself with like a million treatments. But pregnancy is one of them. Those that have got, you know, hypertrophic scarring or keloid scarring, it's contraindicated in that. Also, anyone that's got like an ongoing infection in the skin, like impetigo, or like pustular acne, or like herpes, like cold sores or things like that, and that are on the skin and they're undergoing treatment for that and antibiotics, we wouldn't be treating until that's finished and things have settled down. So yeah, things like that are contraindicated, but apart from that, no, it can be used. It can be used in sensitive skins as well. It's got a great response in a sensitive skin.
Well, that leads me on perfectly to the next question. So somebody's asked that she's already got sensitive skin. Will the treatment affect her skin's sensitivity levels further? So will it make her feel more sensitive?
She'll have the same response, but in actual fact, like it's what anyone else would, but it's not contraindicated in the treatment. In actual fact, she'll get a lovely response from it as well. She'll be on I would imagine, she'd be on a skincare protocol for sensitive skin, and the aftercare that we provide is ideal for a sensitive skin type, because that's obviously what we're trying to, you know, settle down post laser treatment. So no, she'll be absolutely fine with a sensitive skin with this treatment.
Amazing. And what is the aftercare then? Can you mention that there? And that was another question that somebody had asked as well. What is the recommended aftercare?
Well, obviously, not most people that are coming into clinic are on a certain level of like a medical graded sort of skincare range. So we would be familiar with what they're using pre and post. And if they're not, it's maybe something that we would recommend they do to prep the skin prior to treatments like this, where you're going a more medical graded type of treatment. So we would be looking at their skincare and what would be more suitable to use after it, and it's not going to, you know, aggravate it or, you know, make it any more inflamed. We do give a nice mask to take away. So we pop a mask on after it, immediately after, to cool like the skin down. And then what we do is we give another mask away, and they can pop it on that night, and that really calms down all redness from the skin. These masks actually are going to be something we'll talk about next week in the Bloomy chat, but they are like a little piece of magic, these masks. I love them. So these are actually not ones that come specifically for the laser, but they are just amazing after this laser treatment. Oh, I can't recommend them enough either.
Oh, amazing. And people are so conscious of skincare. Like, I know people have always been conscious of skincare, but I think we've spent a lot of time this past year on things like Zoom. Potentially, like maybe having more time to look in the mirror randomly. Do you know what I mean? It's like you've got more dwell time, so more time to focus on maybe things that you're like, oh, what's going on there? So that sounds cracking. I'm looking forward to hearing more about that next week. Okay, so we must talk about the fact that it does have a celebrity following this treatment.
Yes.
Because there's a doctor in LA. How do you pronounce it? Tell us about the doctor in LA, because I can't pronounce his name, and the clients that he's got.
So, to be honest with you, Laura, I really I didn't hear about this through this doctor. I heard about this through like a colleague that I've done, like we've got other devices from, like Novus Medical, it's Jim there that supplied the machine to us and we bought from. And it was obviously we started to see all this research coming through that it was a Kardashian favourite, and I thought, wow, I've just purchased the machine that the Kardashians love and it's the exact same one. I mean, that's just amazing. And it wasn't actually intended to be like that. But yeah, Dr Simon Ourian is how you pronounce it. And he's a very, very popular cosmetic surgeon in LA that started providing the Asclepion laser treatments there. And it is very much a favourite of quite a lot of celebrities over there. So it's pretty much why it's called the Hollywood peel, because it's a very much tried, tested and loved treatment in that side of the world. So it's sort of filtering over here. And actual fact, I spoke to, I did an online consultation with someone at the start of the week, and I was talking to them about this being an option, you know, once they come back into clinic for their skin treatments in preparation to their wedding. And they went, oh, I've heard all about the cool laser. And I said, well, have you? She's like, yeah, I was in the States and they're all getting it. All of them, everyone that you talk to, get the cool laser. It's definitely the treatment you need to get. She says, so I know all about it and it's an amazing treatment. She said, so yeah, I'll definitely be trying it. So it is obviously very, very sought after over there, yeah.
Oh, that's amazing. And like, we do all love a celebrity, like, let's face it, even when you kid on that you don't, like, you do. And with regards to the Kardashians, I know you and I have spoken about this previously, but they are like, they're going back in time. Like, I'm like, how are you? Like, Kim looks younger now than she did like 20 years ago.
I mean, yeah, I suppose you can say they're obviously having treatments like this. And it's like everything I say to everyone, Laura, like anyone that comes into clinic, in all seriousness, a lot of people, especially in this part of the world, are not as skin savvy as what they are in the States. And we really all have to put our hands up to that and think, you know, there's a lot of us that are still just using baby wipes to take makeup off and, you know, are quite lazy with our skin. And often we get a lot of patients coming in that want that quick fix. They want, I just want a wee bit of Botox or some fillers and that's me, I'm good to go. And half the time I'll say, look, before we even go there, we're going to get your skin looking a lot more, you know, optimal really, and get the overall texture and quality and tone looking better, because that is effectively the canvas of your face. So anything that you do over and above that is just going to complement things like injectable treatments and other things that we can do with machine devices and what have you. So getting the skin on point is probably one of the most important things that we say to people in clinic is, you know, really look after your skin, because it will really benefit you in the long run, especially from an anti-aging perspective. So a good robust sort of skin routine at home will serve you well. It's 80% of your journey. Really, it's what's going to really help you, what you're doing at home. And then we just complement everything over and above that in clinic. So yeah, the Kardashians, I would say, are probably doing a few other retreatments in between, and it's all just complementing the rest of them. So it's probably a combination of a lot, which, you know, it is a sort of multifaceted approach. You know, like any good sort of reputable clinic will offer you a various amount of treatments and approaches that's going to be bespoke to you and target your specific needs. If they're not, then you're probably not getting what you want from that treatment. You would really want someone that's going to bring you in and do a full, you know, consultation and have that complete pan-facial approach to your consultation, whether looking at skin as well as, you know, volume loss and everything else and sagginess and whatever else. So it all works together.
All goes hand in hand. I actually seen a Insta story of Chloe getting the cool laser.
Oh, did she? Right.
I see that it's a story of her doing it. So yeah, I was like, right, sold, because she's my fave. I have to say. She's my fave. Right, okay, amazing. Right, okay. So sun damage. Someone's asked about sun damage. She says she has plenty of it. Will this treatment help her?
Yeah, because like I said, you know, we need to have a look at the sun damage that she's talking about, and if it's, you know, dark spots or pigment or whatever, yeah, it's going to help with things like that. It's going to even out the tone of the skin. But again, we just need to look at our skin and see what sort of depth we're going to, if it's going to be a course of like the lighter peels, or whether she was maybe needing to go a wee bit more aggressive to get rid of that and get a more sort of uniform or unified appearance and complexion. So, but yeah, it can definitely help with that. Yeah.
Okay, amazing. Right, okay. And it's also said to help with certain skin conditions, and it might be, as you say, the kind of deeper level laser. But what kind of skin conditions would it be said to help with?
So, I mean, it can help with a variety of skin conditions like birthmarks, lesions, fine lines and wrinkles, you know, acne scarring, there's a whole multitude of skin conditions. You know, what we would do if someone was having like acne, like I said, active acne, and if there's pustules there, we would need to control that outbreak first, because all you're going to do is just create more spread if you're not treating that first. So it would be more to do with something like that. The aftermath, like the scarring and things like that. But, you know, there's a whole load of skin, you know, conditions that it can treat. Even the likes of yourself, mum, your mum, Laura, you know, like that's got previously had laser and has got maybe a bit of something that she wants to address. There's lots of things that we can do just to sort of even out the tone and the conflict really of the skin.
Okay. Amazing. Right, great. Okay. Someone else has asked, which I think is actually quite a good, these two questions probably go hand in hand. Could the laser be used somewhere other than the face, and then would it work on cellulite?
Right, okay. So yes, it can be used in places other than the face. It can be used for stretch marks, and it works really well on stretch marks, more to do with the silvery ones rather than the red appearance of stretch marks. But yeah, it's very effective on stretch marks. Stretch marks, I would never say can be completely removed, because the dermis is ripped, it's destroyed, so we can't actually completely eradicate a stretch mark. But that's where we can certainly reduce the appearance of it and make it look less noticeable. And again, we can get stretch marks all over the body. So yes, it can be used for things like that. Cellulite, I would say no. Laser is more for a skin tightening type of treatment. Cellulite's a whole different other ball game. But at Sur Medispa, we've got a solution for everything.
Oh, there we go.
So we've got an amazing treatment for cellulite, which is shockwave. And that is a game changer for cellulite. We might need to do another live in that, Laura.
Oh, that sounds really, really interesting. If you ever need someone to trial that out.
Well, you know where to go, Laura, just come and see me. We'll do a wee demo, we'll just keep it a nice, we'll do a Facebook live and that, and you can get your cellulite out.
I would have my arse out.
Yes, well, I'm sure it's a lovely bottom as well.
Oh God, I'd have to put some kind of community disclaimer in that. Right, okay, amazing. Right. How many treatments would you recommend? So say someone's got a wedding or like a big glittery event when we can go back to them again. Like, how would one treatment be enough to make them feel like glowing, or would you recommend like a few treatments?
No, I mean, if they've not got anything specific that they want to target and they just want a sort of nice all-over rejuvenated glow, one go with the Hollywood sort of light laser peel would be enough to give them that outcome. So maybe like a couple of days prior to their event, you would just get a like sort of couple of passes of the laser, and it would just give them that really nice sort of radiant glow.
Amazing. And then so they could 2 days later be at that event. There's not really any downtime or anything.
No, it's minimal downtime. Like I said, it's like a slight mild erythema, which is like redness to the skin, the day of, and maybe sometimes into the next day. But we obviously, the mask that we give really controls that sort of redness in the skin, and obviously the ingredients from the mask as well really complement what we've done to the skin. So no, a day or two later, you can absolutely go and have a nice radiant glow in your event.
Brilliant. And ideal to try not wear makeup maybe like the next day, would you say, or can you do that?
Well, I would always say, I mean, I'm not a big, makeup wearer after things like that, because I always like to think my skin's really clean now and I don't want to really contaminate it with anything. But, you can wear mineral makeup now, which is good, for post-treatment. So things like that would be fine. If you're quite, self-conscious, then the next day you'd be fine to put makeup on. I wouldn't put anything on the day of the treatment, but 12 hours, 24 hours later, you should be fine to put some makeup on. I would advise more mineral makeup than anything else, but yeah, you should be fine with that.
Amazing. And what about sun? Because you could probably see I've got a bit of a burnt face today, I'm not going to lie, but
I was actually going to say you're looking quite sun-kissed there, Laura.
It's the redhead in me, so half my family are all ginger, so I've got basically ginger skin, and honestly I could look at a light bulb, which I've got a very bright one here just now, and I would burn. So what about going out in the sun after it? You're probably best to stay.
Yeah, and always obviously, part of your part of your aftercare is wearing an SPF, obviously to avoid any risk of, hyperpigmentation post-peel. But again, anyone that knows me and knows the clinic knows that I always say you should be wearing an SPF every single day as part of your sort of general skincare routine. So yeah, you would just be told to wear SPF, absolutely, and avoid sun exposure. Yeah, definitely.
Okay, right, amazing. Right, okay. Let me see where the next one is. Okay, so somebody else has asked, how effective is it on wrinkles? Like, does it remove them or does it make them appear less deep? Not sure if that's the correct terminology. So that might be the deeper one.
Yeah, so we kind of touched on that actually just when we were talking about the full ablation, going that, real aggressive approach. Absolutely. This is a class 4 laser, Laura, which means it's a medical graded laser and it's delivered by myself, who's a medical professional. So we can make medical claims that this will remove signs of aging, as in age spots, lines and wrinkles, but it's going at a level of more of the ablation, full ablation, rather than the light laser peel. Light laser peel, if you were to do like a progressive rather than aggressive approach over a period of time, will reduce the appearance, yes, and help with overall complexion, texture, quality and tone. But if you were really wanting to target, like I was saying earlier, like some fine lines here or across the mouth, then absolutely this is what's going to, a full ablation approach is what's going to get rid of that. And I've got conviction in what I'm saying there. It absolutely will do that. You just need to be prepared for the downtime.
Yeah.
And I always say, like, to people, it's not a like for like with Botox, and it's not a comparison to be made. Botox treatments like anti-wrinkle injections with botulinum toxin, that can be used in certain areas of the face where you're relaxing the muscle. Whereas this is more of a skin focused treatment where you're actually targeting specific areas, and it's 9 times out of 10 it's this sort of area here and here, where typically Botox treatments or anti-wrinkle injection treatments aren't going to be somewhere that you would necessarily target with. So it's not a like for like, but it can most definitely remove lines and wrinkles.
Right, okay. And that actually, you have kind of covered this, right? Because this is the next question, but I think I should ask it because it's good to hear what you're saying there. So this woman has said, I'm in 2 minds between growing old au natural or getting some aesthetics works done. I guess I'm scared of looking fake in my 55 years. Does this type of facial go hand in hand with anti-wrinkle injections? Could it be used as a substitute? Obviously, we're saying no. And if I simply had this treatment, what would be the visible difference in my face if I had it alone or if I combined it with anti-wrinkle injections?
So you could, all of the above really is fine. She could combine it with anti-wrinkle injections. It depends if she's got particular areas of the face where it's like frown lines and round here, then anti-wrinkle injections are really good for that and very effective. And it's something that we do in clinic a lot. It's pretty much the bread and butter of our revenue, to be fair. But if she was a bit, reluctant to go down that road and wanted to look at an alternative, then this is a good alternative.
Okay.
But it's not a substitution. It's not a replacement for it. It's because it's a completely different approach. It's a completely different treatment. Like I said, anti-wrinkle injections work with relaxing the muscle that creates the sort of lines in the face in certain areas of the face, whereas the laser is going to target fine lines and wrinkles sort of all over the face. But if you're continuously frowning or you're doing this and you're scrunching your eyes, whatever, these lines are going to come back for that reason. So they're 2 totally different treatments, but they most definitely do complement each other. And I wouldn't say don't have your anti-wrinkle injections and do this instead, because if you did want to do both, then wow, you would be looking very, very fresh in your 50s.
I know.
What I will say though, and this is a big concern of a lot of patients that come to our clinic and just across the board going into a lot of aesthetic clinics, is that a lot of females that have not actually ever had facial injectables are a bit reluctant because of that fake look that you were mentioning there, Laura, that they don't want to look fake. But what I will say, without getting, because that's a whole other topic entirely, but if they're going to a reputable clinic, to a medical professional that's carrying out these treatments, it's done in a way that it can be done very naturally, and it's not obvious to anyone else. and they just look like a nice rested version of themselves, rather than a fake, overfilled, over-enhanced, you know, a 50-year-old trying to look, you know, with the face of a 30-year-old. It doesn't meet. You've got to keep it in line with that person's age and just soften things a wee bit and make them look a bit more refreshed. That's certainly my approach at Sur Medispa. I am never one that wants to advocate a fake look or an overfilled look. So very much that's that whole holistic approach, that pan-facial approach that I was telling you about in the consultation process, where we look at absolutely every option that's available, and we go through that whole approach with every single person and work out what's right for them, because what's right for that person might not be suitable or what they actually want, and they want to dip their toe in slowly and just go gently. So this is a great alternative to, you know, facial injectables, but I would say it really complements facial injectables as well. So it would be a build up as well. So and
also so important why you know, a consultation, like just to get that let there be light.
You're sitting in the dark there, it's like better put the light on. Magic.
I know, I was like, woo. Why like a good consultation is important, so like, because I'm sure that there would be a lot of ladies, women, you know, maybe men as well, that would come into it and actually just not have a clue, and they would just be like, right, you know what, even so it's important to have that consultation, isn't it?
That's the most important part of the whole process, is the consultation. I think it manages the patient's expectations as well. It gives them a really good opportunity to speak to the practitioner and get a feel for that practitioner that's going to be carrying out their treatment, build up that rapport, you know, find out what their credentials are, I mean, it's so important to find out who is actually doing these treatments. There's a lot of unscrupulous activity going on out there just now, and that's where a lot of the problems are coming from, because people aren't doing enough research into who they're going to. But the consultation process for me in clinic is probably one of the most important parts of the whole process, because it allows me to understand what the patient's looking to achieve, and it allows me to sort of manage that expectation and explain to them what we can do. So I would say the consultation is really, really important.
No, that's amazing. And like, and it's just good because it is, I guess, you know, the first time could be scary, so it's good to have like just someone that you trust, and as you've said, Karen, you know, do the research. It's so important.
100%.
Okay, amazing. Right, okay, so the next question was all about consultation. So you offer lots in Sur Medispa. So say for example, if someone was to come to you, Karen, and they're like, right, I've seen the Hollywood laser and this is what I want, but through consultation maybe it's not what they like. So would you be able to say, actually, this machine, because I know that you've got quite a few technologically advanced offerings, would it be that, you know, maybe something else is better and you would be able to just talk to them about what else is available?
I'm never guided by what the patient wants. Some people come in and they think they know what they want, and then that's again where you nail it in a consultation, because like that, a lot of people are misinformed. They're maybe Googling a lot of things and getting the wrong information, or they're saying, oh, my pal's had that and I want that and I want to look like her. And or we come out, a lot of people present with pictures and go, you know, you're a completely different facial shape. And, you know, it's so important to, you know, maximize that time that you've got with the patient and guide them and keep things in perspective, you know, and make sure that you're delivering the right treatment that's right for them. So I'm never, as a professional, guided by what they want and I'm railroaded into do it, because 9 times out of 10 I've found by experience of other clinicians and myself when I was new to the business and the industry that they would come out not happy. So they're coming to you as a professional, and it's for you as a professional to guide them correctly, and it's got to be always about patient outcome, patient safety before patient profit, or before profit the business, because you'll, in the long run, you will get a much better result and you'll get a much better rapport with the patient if you're getting, you know, complete trust and confidence in you as a practitioner, but the best treatment outcomes. So a lot of the time they might come in and say, I want this cool laser, and 9 times out of 10 it's going to be appropriate, because everyone can benefit from a good skin treatment. But there may be other things, depending on what they're trying to target or what they're trying to get from that treatment, that we can sort of guide them down a road of saying, maybe try this first and we can revisit that. But that's what we say, we do a patient journey in the clinic. It's not just a one quick fix or one treatment. We kind of take them on board and they go on the journey with us. So Yeah.
Brilliant. Brilliant, brilliant. Okay, so the final question was around cost. What's the cost of this wonder treatment?
It's a wonder treatment. So it's £115, and with that's included in your masks and your aftercares and all the rest of it. So that is it for one peel. We can package up some peels as well, if they want to do like a course of the like a sort of progressive type Hollywood peels where they don't want to do the aggressive type.
Yep.
We can package that up, say they want to do maybe 4 or 5. We can look at that and do some sort of package deal for them. Also, the more ablative is more price on consultation, because again, that's a whole consultation process. We don't know how sort of depth we need to go to. The aftercare, sometimes we need to consider prescription of antibiotics and things if they're going for full ablation for aftercare. So that's more on consultation, and I wouldn't really like to give a price on that just now. But certainly for the light laser peels, you're looking at around £115, which includes your aftercare with your masks and things as well.
Okay, amazing. And also, are we exclusive on the live?
Yes, you do.
There is two members offers. So we've got our offer for the members of the GGC website, and then we've got offers for ladies in the community. So what have we got?
So I think for the members, is it 15% we've got, and for the ladies of the community, as you put it, Laura, is it 5%? 5%.
Amazing. Right, that's so good. So would the ladies of the community getting in touch with you, they quote GGC 21?
I'm sure it is,
GGC 21, and then the members will find out how to redeem their offer by logging onto the website, because they'll need to go through the GGC app.
Yes, definitely. So, by all means, anyone that's watching and wants to know more about it, again, they can just get in touch with us and we'll go through that consultation process. Obviously, it's all getting done online just now, so with something like this sort of setup, it gives me a chance to sort of get to grips with what they've been doing, what they're using, what they want to achieve, and how their skin is at the moment. So, we can organise a consultation at the first instance, and then we can look to get them booked in and take advantage of that amazing offer.
Oh, amazing. So good. And if there has been any questions asked on the live, I can let you guys go back or ask Sur Medispa direct. I'm conscious of time as well. So, and also the fact that I look like I feel like this whole room's like in pitch black.
Well, I've kindly got an assistant here that put the light on for me, because I was sort of fading into the background that all you could see with my dark hair, my black shirt with my sort of face popping out, so I was kindly came back into the daylight there a wee bit.
It's like the Zoom light.
I don't have a magic switch under my laptop here that just puts the lights on.
Well, see, I've got this wee, like, it's actually called, randomly, it's called a jobby, right? And it's like a fan, and it's got this light on, and honestly, I'm not kidding on, I feel like I'm totally blinded by it, but it's flickering now, and I'm like, that's going to go off, and then I'm going to be in complete pitch darkness. So this could be a good time to just
it's going to say let's end it now.
I know,
into darkness.
That was brilliant, Karen. I'm buzzing. It sounds like a really cool treatment, and like I'm really excited to find out.
We are too. We are really, really excited to get going with it in the clinic as well. So we're all excited. You'll need to come, Laura, and give it a try.
Well, I mean, you'll wild horses won't hold me back. See, when we're allowed to do stuff, honestly, it's just people are just going to be out and about. Like, I'm just out because I can be.
I know. Well, exactly. I know. And while I'm out, I'm going to get my Hollywood laser peel.
Well, yes. Well, exactly. Amazing. And use my GGC discount.
Absolutely. Yes.
Quite right.
Definitely.
Right. Brilliant. Well, thanks so much for taking the time.
No, thank you.
Next week, we're on talking about the Bloomy.
Yes, we're on talking about another amazing facial treatment, slightly different to the laser, a completely different platform to laser, but another really nice facial treatment that's very new to Scotland as well. In fact, very few in the UK have got this either. So this is a one that's came from France. Yes.
That's good. It's got all these exclusives. That's really, really good. I'm just actually wowed by the technology.
No, I know, and there's lots of it out there, and this is the thing about things like this, it's so educational because you're getting the real true facts of the treatment, rather than just trying to research it yourself and maybe getting misinformation as well. So because there are so many technologies, devices that are out there and just don't know if it's right for you, and
Yeah.
if it's even in the right hands. It could be the right equipment, but being delivered by the wrong person or the wrong professionals or not professional. So yeah, these things are great just to get the right message across.
Oh, brilliant. No, well, thank you so much for taking the time, and we will see you next week.
Yes, I shall see you then.
Brilliant. Right, I'm going to stop this live stream. Bye, everyone. Thank you for watching.
Bye.